All right, this video is for anybody who's ever posted an MRI inside of a group, like a Facebook group, and you were looking for answers, and afterwards you were left more confused than you started with. Or maybe you've gotten an MRI and your provider who ordered the MRI barely went over it or just brushed right through it, giving you some simple answers, and you're still left confused and you don't know what's going on. Yet you still have pain. You're trying to figure out where that pain is coming from. In this video today, we're going to be breaking down, doing a new MRI breakdown from Brooke, who has some questions about surgery and who should she go with in surgery. So again, we're also going to be talking about some different criteria you should be asking when you're thinking about getting surgery and who you should go with, either a neurosurgeon or a orthopedic surgeon. So that's the basis of our breakdown for today. Let's see. Now, I just want to throw it out there, a little disclaimer. The video that or the pictures that I'm about to show you are just still images, and there's no way that I can give you a full picture of what's going on with the person because I've never met the person and I don't have all the images, and we'll get into that in a little bit. But this breakdown is for informational purposes only. There's no way I can give you specific diagnoses or treatment plans or anything like that because again it's for informational purposes only, and we're just trying to answer some questions for some people to get some clarity, and preferably that will help you too in your plight to try and get some relief from all the symptoms that you're having and get some understanding from your MRI. So let's get into it a little bit. Who's this for? Again, anybody who's had a MRI recently and have questions about their MRI, you have the report, but you can't understand the language. There's some things on the images that look crazy, and you're trying to figure out what it is. That's what the purpose of this for. If that's you, then you're in the right spot. So let's see. One of the things I want you to understand when it comes to MRIs is that the crime doesn't always fit the punishment. What I mean by that. So a lot of times people are looking for something on the MRI to match up with what they got going on. And sometimes it does, but not all the time. So you have to keep that in mind. And you'll see a little bit that maybe I can't remember in this image that I'm about to pull up, but if you stick around, see some more of these videos, you'll see that come up with a lot of people. Again, pain doesn't always equal findings. So let's see. Let's go to Brooke's question here. Let me pull it up. So Brooke was asking, and I'm kind of paraphrasing here, is it necessary in my case to go to a neurosurgeon or can I go to an orthopedic surgeon? It says, I've been told so far that I have L5 S1 disc herniation on the left, pushing on the lateral recess zone. The S1 nerve is getting pinched, and it's been there for a minute, and it looks degenerative. I've also been told that I need a laminectomy or laminotomy to clean things out. The worst of my symptoms get is when she's experiencing sciatic spasms starting in the butt and into the calf and tingling into her foot. She says, I'm currently on muscle relaxers, Tylenol, and Advil every 6 hours for the last month. All right, so let's get into her image here. And I'm going to pull it up. I'm going to probably have to, I want to share my screen. Again, forgive me about the picture. This is like the best I can do. Um, but let me see. I think I have to share the screen so you could see my cursor. Let's see. All right. So I hope that you're looking at this. If not, I will have to do this video all over again. But preferably you are looking at what I am looking at. You can see my cursor moving around. That's like the biggest thing that I want to make sure you can see my cursor. So again, this is an MRI of the lower back. That's what she was talking about. These are the last few levels here. I kind of blew it up so it's a little grayish and not all that clear. but you could see the gist of it. So just an explanation about your MRIs and your images. When you get the MRI, it's basically taking a picture. Imagine someone's body, you're looking straight at them, and they're taking pictures, but they're taking slices. The pictures are slices going across all the way through their body, through the center, and all the way to the other side. Kind of like the old when you have a little book and you draw a stick figure in it, and then each page you have the stick figure moving the legs a little more, a little more, a little more, and then when you um, hold it and flip it all the way through like a little flip book, it looks like the stick figure is walking. So that's basically what's going on with the MRI. It's slices of your body, and then this is just one of those slices, and it looks like it's about in the middle, and that's the view, like it's like the money shot that we want to look at. So a couple of little things. This right here is the back of the spine. In the front would be your stomach. And these, of course, are the bones. You can't really see it that well here, but you got the spinous process there. But again, these are the bones. You have the disc in the middle, bone, disc, and so forth. Your spinal canal is here, and that's the fluid that's in there. And also the spinal cord, these little strands or pieces coming down here. That's part of the spinal cord coming down. So as you can see, the coloring in here is a little lighter. Then when you get down here, it starts getting dark. Also, you have this bone here that's a little lighter color. That lets us know that there's some new things going on, basically, to put in layman's terms. Um, but what she's describing or talking about is this area here, this disc that's sticking out here in the back, and that's a bit of a herniation there from my point of view. Again, I don't have all the actual pictures to be able to look through. When I pull this up on a computer, I can slide through all the different pictures and get a more 3D picture and understanding of what's going on. But here is just a still picture, 2D or whatever. So we'll do the best that we can. But basically, this part is sticking out there, is protruding out, and that is the part that we're concerned with. If I'll pull up this next picture here, hopefully this all works. All right, so this here is a slice going horizontally. So it's basically one slice, and and the back is down here. This is a person lying on their back. Their stomach would be up top, up here, but we're zooming in on the spine, which this is the spinous process. This is the bony part. The spine is made up of bones sitting on top of each other. Well, that is this part right here. And again, we're looking straight down, like we are looking at the person's head straight down to their toes. And this area is dark, that lets you know it's a disc level. And the disc I don't have all the other pictures to be able to explain it, but the disc sits right on top of the bone, but it looks like a bean shape. And so it kind of comes, or should come, up, down, and around here. There should be a little indentation up here. But obviously on hers, it doesn't indent up. Actually, it sticks out. This here is your spinal canal here. These little pieces here is the spinal cord. Again, that's little feathered tails or whatever, not feathers, but tails of the spinal cord at the bottom, and it is sticking out. That is the herniated part. This could be a tear here. It's hard to see in this picture, but it's either a tear or the disc is just sticking out in this direction here. And what you can't see here is the branches that come off the spinal cord. You have your spinal cord in the middle, you have branches that come off. The branches come off and they go out in this direction, off to this side, which is the left side. It is likely compromised. It's not enough space in here, and it's probably pressing on those nerves. It appears that way from this slice here, but the best way is to be able to look at all of them all together, and we do that in an MRI breakdown. But here we just have the pictures to look at. So that is what's in question here. It's sticking out. It's probably pressing up against there, and that is what's giving her symptoms any of that stuff could be coming up. Plus, of course, back pain. You have a bunch of little nerves around here, and whenever the disc is sticking out, it can press on those nerves and cause irritation. But, sometimes I've seen people with really big, huge herniations and have no pain at all. It really depends. So let's go back to her question and see if we can answer all of her questions here. All right, so let's pull up Brooke's actual question again. And Brooke wanted to know, is it necessary for my case, in my case, for me to see a neurologist or not neurologist, excuse me, a neurosurgeon or a orthopedic doctor or orthopedic surgeon? And the question, both of them have gone to medical school, of course. And the thing is, Neuro I keep wanting to say neurologist. A neurosurgeon, has studied, medicine from a, spine and brain, spinal cord perspective. That's what the track that they went down. The orthopedic surgeon went down the bones and joint track of learning medicine, so specific for those things. But the both of them actually went to the same fellowship, the same spine surgery school in order to learn how to do spine surgery. They don't teach spine surgery to neurosurgeons and orthopedic doctors in their particular schools. You have to go to a spine fellowship or spine surgery school in order to learn. So both of them actually get the same training in the same place. So to say one is preferred more than the others is not quite the right question you want to ask. The right question you want to ask are who's more proficient in doing that particular surgery that you supposed to have done. That's a better question to ask. If you have somebody who hasn't done that surgery a lot, or you know, m- maybe they're fresh out of school or something, it's a different story. And I say that because each year the surgeons, I used to work with a spine surgeon. I'm a physician assistant, by the way. I don't know if I told you that earlier. My name is Anthony Wade, and I've been doing this for a long time. But I used to do spine surgery, and my surgeon each year, sometimes more than once a year, would go to learn about some new technique that came out to do either a particular surgery or some new surgery. Or new way of doing, a surgery that they've already been doing, or some new apparatus or tool that they're using to make it better, easier, faster, or whatever. So, every year these surgeons are getting more and more information and learning new techniques. They should be, to sharpen their skills and whatnot. So those are the type of questions you want to know. How much surgery, I mean, how many times have you done this particular surgery, as opposed to are you a neurosurgeon or orthopedic surgeon? The other thing you want to ask is, are they um, board certified? There's some doctors that are out there that are not board certified. So you want to make sure that you're kind of getting the best possible doctor, not what school you went to, per se. It's what skills do you have? What credentials do you have? Another good question. Well, first of all, you want to know, has this, before this surgeon wants to open you up, have you exhausted all the conservative treatment that's out there, the PTs and chiros and physical therapy and the stretching and the exercise and the building up of your core, all these things, plus a lot more that you can do. I get into in other programs and stuff, things that I offer, but that's a whole other video. But you want to know, have you exhausted all those other options that are out there? If that's the case, then yes, you want to consider surgery. But how about ask, for some references from that particular surgeon? Ask, can I get the phone number of some of your previous um, patients after they've had surgery with you? Because it's one thing to be a great surgeon and can do the job, but what about after the surgery? What about, the follow up afterwards? Some surgeons, I hate to say, but they do surgery and after that they're like, hey, good luck. So you want to make sure that that is somebody that you definitely want to work with, because you might be seeing them more, heaven forbid, but you might have to see them a few more times, and you want to make sure that they're there and they're that type of surgeon that really cares and takes the time to make sure and explain everything. Again, especially with these MRIs, a lot of people just rush through things, do their job and be like, hey, deuces, So you want to make sure that that's the type of person that you want to be with, and that are real confident. They're all confident, but those are the type of questions you want to ask. Also, let me think. There was a couple of more. You want to exhaust all the different stuff that's out there. Gosh, I'm now having a brain fog. You definitely um credentials, tried everything. Let me pull it up because I have my notes here. Had it all memorized. Now I can't remember. Oh, yeah. The diagnosis. You want to make sure you have the right diagnosis, because last thing you want to do is operate on some level and find out that that wasn't where all your pain's coming from. So you want to make sure you get the right diagnosis and that they are sure that this is the problem that you're having, where the pain's coming from, and that particular surgery that they're going to do is going to prayerfully fix the problem. So you don't come back still in pain after you've had all this stuff done. So, does the crime fit the punishment? In other words, let me see. Board certified. Make sure I've caught everything. Yeah, about the asking for credentials, you could also, not credentials, but references. You could also go and check online. They're different, not referrals, but uh, oh my goodness, people always leave their reviews. That's the word I'm looking for. You gotta check the reviews, but you gotta keep in mind about that. Like I said, we used to do spine surgery and most of our patients got better. I'd say about like 50 or 60% got better. But there's always a group of people that did not. And there's reasons why some of those people did not. But the ones that did do better, a lot of them, they're off to the races. They're back to their regular lives and their job, and they say thank you, but then they're gone. The ones that didn't do so well, those are the first ones that go online and do. They got plenty of time and they're still in pain, so they're just this is terrible. It doesn't work, and so you got to take that with a grain of salt when you read those reviews. Try and get a full picture. That's why you talk to some success rates, and you might look and see some that did not, go so well. But you want to get that full picture before you decide on what provider that you want to go with and what type of procedure you want to have. So, I think I hit all of those now. Um, the reason, for this is you want to equip yourself with all the information that you can before you make the crucial decision to go under the knife. And that is my goal, to be able to break this stuff down for you and to give you a clear view of what's going on, so it can arm you with the information so you can take it back to your provider, have better questions to ask, and to get some better answers. So I pray that this has been some help for you. Listen, if you are going through this yourself, if you've had an MRI done and you're confused about what's on it, what's on the report, what's in the images, it's not matching up from what they said at that brief, description of what's going on that you have with your provider, and you want a more in-depth, personal, one-on-one breakdown of your MRI, that's something that I do, and I would love to offer my services to you. I'm going to go ahead and drop a button here, so you can click the button so you can reach out to me. If it doesn't work or for whatever reason, you could always reach me through Facebook or on my YouTube channel, and you could reach out to me. I'd be glad to get back with you and see if I can help you out in some kind of way. So again, make sure you're asking the right questions and you're getting the information that you need so you can make the right choices for you, so you can get the right outcomes that you're looking for. So I pray that this has been some type of benefit for you. That is my goal always. Make sure that you're checking all your resources and doing all the conservative stuff first. And if you ever have any questions, feel free to reach out to me. I'll do my best to answer your questions. So, again, my name is Anthony Wade. I'm a physician assistant. In this aspect, I'm more of a natural recovery coach. So, if you have any problems or questions, feel free to reach out to me. So I had fun doing this and I can't wait to do it again. I'll see you guys soon.